Another headline story: the Greater Accra Regional Directorate of the Ghana Health Service has declared the cholera outbreak an epidemic. The disease has claimed 67 lives and 3,000 cases reported.
Cholera, since its outbreak, has claimed 67 lives as at Wednesday, August 13. The Adabraka Polyclinic alone, which recorded 419 cases as at Wednesday, August 13, had the number increased to 476 in the morning of Thursday, August 14. 4 deaths had so far been recorded at the facility. The Greater Accra Regional Directorate of the Ghana Health Service Wednesday declared the outbreak an epidemic.
Because the condition has spread to other districts, and the Greater Accra region is the one that supervises all this region for the volume of or the number of cases that they are seeing. That is why they have declared that. But our sub-metro has been seeing cases since 26th of June.
He indicated over 90% of reported cases were from people who had patronized food from roadside vendors. Dr. Davis Tay added unmarried people between the ages of 21 and 30 years, mostly students and traders, were the hardest hit. He entreated people to eat hot food. The sub-metro director, however, said they were not losing out in the fight.
Admittedly, our health facilities are overwhelmed because of the number of cases that we are seeing, but we have put structures in place. You realize that the facility has created an annex that they are taking cases. In addition to that, we have also opened other centers of cholera centers as civil service clinic.
He blamed the continuous spread of the disease on people's disregard for hygienic practices. He believed if interventions are implemented, there would be a reduction in the number of reported cases.
The evidence is overwhelming that if we want cholera to be a thing of the past, then we need sanitary reforms in this country, and individuals have their role to play in generating waste and taking responsibility for their health and for what they eat.
So we're still staying on cholera, and the General Hospital has recorded over 700 cases with 9 deaths since the outbreak. On Thursday, August 14, 2014, as at the time TV3 visited the hospital at 1:30 p.m., the hospital had recorded 61 cases of cholera.
This was the situation at the General Hospital.
And then 3 days, we could do some bankubi. We could do and then we ran first one, but I'm the say normal. Timra and I twice best at trainers.
I had cholera after eating cold food, but I am recuperating at the hospital.
Could you? If I said one day you pa and they knew Tina Mamma, the Bahasin, but my Bahan, the BI okay.
Overwhelmed by the number of cases, the hospital had to convert its outpatient department into a ward for doctors to attend to patients. The hospital has the capacity to attend to only 13 cases at a time.
From midnight till now, we have a total of about 46 cases, and then from 8 a.m. to now, we've seen 15 new cases. So it's not really coming down compared to the cases that are coming. We are stretched, but we are trying to do our best to provide the care that they need.
We cannot take all these cases at the cholera bay. That's how come we are nursing some on the benches. It's an intervention we have put in place to forestall unnecessary deaths as a result of the cholera. We need support from benevolent organizations and individuals. We need items like disposable gloves, disposable apron, bleach.
The number of cases keeps increasing by the day, particularly in parts of the capital.
To the global health scare, which is Ebola, and the Noguchi Memorial Institute for Research and the WHO have donated protective gear to the staff of the Komfanoche Teaching Hospital. The donation is towards the protection of health staff while discharging their duties should there be an outbreak of Ebola.
For some time now, we've been following the Ebola deadly virus, and asking health facilities, are they ready to actually arrest the situation in case any case is recorded? And now I'm at the Konfanochi Teaching Hospital, and very soon we will be speaking to some of the doctors. You understand, Noguchi has supplied, in fact, Noguchi and WHO have supplied some medical materials to these doctors to attend to cases. That's a piece of good news. Then I will be speaking to the public health director here to tell us if what they've gotten is enough to actually cater for the doctors who will be attending to the cases, if there should be any case at all here at the Konfanochi Teaching Hospital. At least you have some protective materials should you have any case here of Ebola.
Yeah, that's very good news, because a lot of the staff are concerned because health workers have been victims as well, and the key thing is to get these protective equipment to be able to protect yourself in case you have to deal with a suspected case of Ebola.
What is this? And I can see, I mean, the whole place of his body is covered up.
Yes, so the principle is this: the disease is a disease that is spread by coming into contact with any fluid from the person. Okay, so the virus has been found in saliva, in tears, in discharge from the nose, even when they vomit or even the stool. So you don't want to come into contact with any fluid that is coming from a suspected or a confirmed case. Indeed, that is our precaution as health workers, to avoid coming into contact with these. And that is the objective of the personal protective equipment, which my colleague here is demonstrating for us all to see.
In a situation like this, there should be an inbuilt oxygen. Where is he breathing from?
Well, the mask is permeable, so he can breathe through it. There are instances where you need a complete circulation system. That is not what we are dealing with now. So he can be able to breathe through the mask. I've personally worn it, so I know how it feels to also be in it. And as you can see, from head to toe, every part of his body has to be covered. It comes with its own disposable bag. So once he takes this off, it is going to be incinerated or burnt. So this thing is not going to be reused, as it were, to put anybody at risk of infection.
All right, let me speak to Dr. Ernest Kwakon. Doc, you have a protective costume. Isn't it enough?
Yes, I think the director, the head of public health, has said it all. We still need a little more assistance. We are trying to create a holding area where Ebola disease, viral disease, and other diseases, we can actually do barrier nursing for such patients. We are not quite finished yet. We will still need a little more support. One of the things that comes to mind easily is the infrared thermometer, where we will be able to screen suspected cases using this piece of thermometer without directly touching the patient. We will need things like that. We will need other support. The hospital is trying its best, but I guess that both the ministry, the various institutions will also need a little more assistance, so that we will be able to have such holding areas while we are waiting for the national isolation centers to be set up. Definitely.